Today's recovery of the month is going to be a little bit more full body focus. Welcome, Dr. Amy here with you guys today. Please subscribe to the YouTube channel. Constantly trying to put out some content and some information on what physical therapy can do for you. Thanks for joining in. So we're going to get right to it. We have 4 different movements. And follow along, pending your time constraint, 1 to 4 cycles. So first movement, you might add, we're gonna get in this half kneeling position. I'm gonna actually switch knees because that knee's a little tender for me today. But you're gonna do on both sides a half kneeling hip flexor stretch and transitioning into a hamstring. So hamstring position stretch. So this is what it looks like. So we're just gonna rock forward and get into this kind of hip flexor stretch. So I'm really trying to elongate this side. Then I'm gonna sandwich or transition back to this hamstring stretch on that opposing leg. So I'm just gonna rock back and forth. So I'm stretching my right hip flexor and then I'm transitioning back to stretch my left hamstring. I'm gonna do 10 of those. So you might probably want some knee protection with this. I forgot to grab my knee protection. I'm gonna go 1 more on this hamstring, then I'll flip to the other side. Again, we're going to do 10 reps on each leg. So you can kind of see me in this position. Well, hopefully my knee won't be as tender. Again, I'm gonna get into this long hip flexor position, and I'm gonna transition into this hamstring on the opposing leg. Sometimes I like to tuck my back toe, if you can see that on the camera, on this hip flexor stretch, even on that hamstring stretch. So that's kind of a little bonus. You get the toe stretching on top of this. So we're just moving back and forth, so hip flexor stretch, hamstring stretch here. Hamstring, we really want to focus on that knee keeping straight. You can add a little tug here if you want a little bit more. 1 more time. Get some crack-a-lacka in here. Made you laugh, okay. All right, next movement, transitioning into the cat-camel position. That's what I call it. Some people call it cat-cow, but we're gonna get on all 4s and wrists underneath our shoulders, knees underneath our hip joints, and we're going to try to sink our belly button towards the floor and look up towards the ceiling. So think if you had a tail, that tail wants to go up, and then we're gonna oppose that position. So I'm gonna tuck my tail or draw in the belly button, push the ground away, flex my neck. I'm gonna transition, I'm gonna do 10 of those transitions. So if I go camel or cat, push, poof through my shoulders, tuck my tail. That's 1 rep. I know I already did 1 before that. So looking up and then looking down, or tucking the tail or untucking the tail, that's 1 rep. It's rep number 2. So we're gonna go through 10 of these. I'm just gonna demonstrate 5. I'm gonna really feel this kind of like in my lower back. Push, tuck my tail, push. I'm gonna go 1 more time, untuck the tail, look up. And then last time, tucking the tail and tucking my chin. This immediately transitions us into our next movement, which is the Russian baby maker. Why they call this, I don't know, look it up, I guess. But we're gonna get into our squat position or baseball catcher position. I prefer the baseball catcher, number one. That's how my ankles are built. As I transition with this Russian baby maker movement, I'll eventually get in a more flat foot position. So with the Russian baby maker, kind of show you here at the front, we're gonna place our fingertips underneath our toes. That already puts me in this high hip position, probably perhaps with our feet a little bit wider. And what I'm gonna do, I'm gonna really kind of just grasp my toes and pull myself into this squat position and really get my hips facing forward. And then I'm gonna gently drive my booty up towards the ceiling. And then I'm gonna add this little kind of hamstring stretch. I'm gonna transition back into the squat using my fingertips, grasping onto my toes as a counterbalance, driving my hips up. 10 of these transitions. So when I pull into the squat and then transition my hips high, that's 1 rep. I'll show you from this side here, like a profile view. Pull into this squat position, drive my hips up. As my hips are driven up, my nose is looking in between my leg window here. I'm gonna do 1 more. And we're gonna do 10 reps. 10 reps with each of these movements today. All right. Now our last movement, we're just gonna use a wall. A thoracic pass-through. So it's kind of almost like a reverse Russian baby maker that we just did basically for our hips, but now it's targeted towards our shoulder and mid-back. Find some wall space. Probably hands kind of wide to begin with. I'm leaning into the wall. As I'm leaning into the wall, I'm just gonna transition into pushing my head through the window. Ooh, got some nice good cracks in my upper back, which is okay, it feels good to me. And then transitioning out of that window. Transition back in, my hands are staying put. I'm trying to keep my elbows straight. We're gonna do 10 reps. So this really just kind of targets that shoulder complex, some of that lat muscle that runs along the side of our torso. I would say maybe hand position around maybe shoulder height if you're kind of like angled. Some of us might be a little bit more flexible. Maybe your hands are a little bit higher so we can get some more what we call that hyperflexion in our shoulders. I'm gonna do 2 more. I'm gonna raise my hand or lower my arms just a bit more. And just gently flowing through these reps. Just feeling the motion, feeling where we might be restricted. Maybe we need to spend some more time there. I'm gonna do 1 more for good measure here. Nice. All right, so that's it for today. Just 4 different movements. So we have our kneeling hip flexor to hamstring stretch or transitions, 10 on the right, 10 on the left. And then we have cat-camel or cat-cow, 10 of those transitions. And then we have 10 Russian baby makers, and then ending with these thoracic or wall pass-throughs. Pending your time constraints, somewhere between 1 to 4 cycles. Thanks for joining in, and we'll see you on the next recovery of the month.